Well, good evening, everybody, and thanks for joining me in this telephone town hall with people in our congressional district to talk about health care and talk about the bill that Congress is working on as we speak. Uh, in preparation for this and as we worked on this bill, I've been taking a look at the state of health care in our district. We've discovered that there are over 92,000 people in the 15th Congressional District, 14% of the district, who currently do not have insurance. And I know that our hospitals and providers in our district are, when necessary, taking care of these people and providing over $220 million worth of care that they don't get paid for. Now, that care gets paid for somehow or other, even though there's no direct reimbursement. So hospitals are going to have to recoup that $220 million by charging those of us with insurance more money. And so our insurance bills go up in part because the hospitals are providing expensive, otherwise uncompensated care for our uninsured. And I know that there are um, 1,700 healthcare-related bankruptcies in our district just last year. We've seen a record number of foreclosures and bankruptcies over the last several years, and that number for 2008 is indicative of the kind of numbers we were seeing in other years as well, caused primarily by health care costs not covered by insurance, people who have insurance going over their annual limits or going over their lifetime caps or being underinsured and not being able to pay those out-of-pocket costs. So we also know that small businesses are having a tough time paying additional health care costs. And one of the things that we need to think about when we are addressing health care is the cost of inaction. The number of employers will be dropping health care plans because double-digit health care inflation will continue. The number of uninsured people growing in our community, and the impact it has on all of us and on our health. So right now, this bill would take those 92,000 uninsured individuals and would cover about 97% of them. It would provide help in that way for those hospitals who are now providing that uncompensated care. It would provide greater health care and financial security for people who have been struggling to try to pay their mortgages and their other bills and their health care costs. Seniors would get help. We have about 6,100 seniors who are signed on to Medicare Part D, and those seniors would get help with the Part D donut hole. Immediately, they would get relief, cutting brand-name drugs in the donut hole by half, and closing that donut hole by $500 in that first year. And as this bill progresses, each year that donut hole gets smaller and smaller. Small businesses, those with 25 employees or less, average wages of $40,000 or less, would qualify for tax credits that help them provide health insurance for their employees. And I know that there are about 13,300 small businesses in our district that could qualify for these credits. So this bill could provide significant benefits for the 15th Congressional District, and small businesses and families and seniors, all of us, I think, will benefit as we work to lower the costs of health insurance for everyone, provide access for people who are now uninsured, improve quality, continue to give us a choice of doctors and plans, and put a bigger emphasis on prevention and primary care. So I look forward to having a great discussion with all of you tonight. But before I do that, after listening to all these statistics, sometimes it helps to just think about one person. And as you may have known, my website, my congressional website, has a health care page, and we're asking people to give us their comments and concerns and their stories. And throughout the last several months, I've been going around the district and listening to people and hearing their health care concerns, their health care stories. So here's one that we received recently in a letter. And it says, Dear Representative Kilroy, this is not my story, but it is a story of a close friend who died last November at the age of 50. During his life, he was afflicted with diabetes and heart disease. He was self-employed and could not get health insurance because of his pre-existing conditions. A few months prior to his death, he asked me to review a brochure advertising a plan to get discounts on various things, including medical services and drugs, that clearly stated it was not insurance. I told him that the company was not promising anything, only a hope that discounts could be obtained. He told me that he was going to pay the $178 a month anyway because he couldn't get health insurance. Unfortunately, a few months later, he suddenly died. My friend's case highlights the need for universal, affordable health coverage, including coverage for those with pre-existing conditions who cannot obtain insurance now under the current private insurance system. For those who object to a public insurance option, I would ask if their plan would allow those like my friend to be covered at a reasonable cost. It concludes, I wish you well to help coming up with a good health care plan for our country. So, Paul, if there are callers that have questions, let's hear from some.
We're actually going to remind folks that if you want to ask the Congresswoman a question, all you have to do is hit *3 on your phone. That's opposite the pound sign, so *3. And we have a bunch of great folks from our staff ready to take your questions, and I'll actually give you a chance to answer them. So all you have to do right now is press *3. You won't leave the call. You'll just be directed. To folks from our staff that'll take your question down so we can see it and call upon you. And then you'll be put back on the call as soon as you're done. So press *3 right now, and we'll be able to get going with some questions. I also just wanted to mention, Congresswoman, the website that you just mentioned. The Congresswoman's website is www.kilroy.house.gov or kilroy.house.gov if you put it into your browser. There's a lot of information there that how the Congresswoman's office can help you with all kinds of things, especially if we get into this healthcare reform that we're talking about tonight. But especially on that page, there's a healthcare link called Healthcare Choices, Healthcare Changes, and that, if you click right on that link right on our front page, it will give you a ton of information you might need, or the most important thing I think the Congresswoman wants is some interaction between us and between her office and all of you. So please go there, kilroy.house.gov, and you'll be able to interact with us. I know the Congresswoman read the story that she just told you all on the House floor today, and we have a video up because we wanted to make sure that those questions and comments and stories we were getting would also get some feedback from all of you. So I really think that we'll get going here, but we also can do things called polls. We're going to do a poll right now and see what you think. Those of you on the call, we have. I'm just going to tell you, we have a whole lot of people on the call now, over 400, almost 500, and we want to know what you think of the issues. So the first poll that we're going to do right now is what's the most important component of healthcare reform you want to see addressed this year, and that's our first poll question. So if you think the cost of healthcare premiums is the most important thing to you, you can press 1 right now on your telephone. If you think that the quality of care that your family and you receive is the most important thing, you can press 2. If you think access for the uninsured is your primary concern, you can press 3. And if greater choices of insurance companies is your concern, then you can press 4. And we'll let you know about what the most important things to the people on this call were. And I think the Congresswoman will find that very, very interesting. We're going to go out to Norman Robinson, and Congresswoman Norman Robinson, has a call about the public option. So, Norman, I'm going to actually unmute your phone, and you can actually ask the Congresswoman your question yourself.
Thank you. Yes, this is Norm Robinson. Are you there, Congressman?
I am. How are you tonight?
I'm doing real well. And right now, one of my major concerns is that any reform has a public option available. I think that without that we probably are not getting exactly what we need. I think the public option is very, very important. I want to know where you stand on the public option, and do you favor it, and if so, what does it look like? There's a possibility of us getting a public option.
Yes, I do support a public option as part of our insurance reform plan. And the current bill contains a robust public option as part of that as well. And one of the important things about a public option is that's one of the ways that we're going to control costs.
Yes, that's
A
why
public option would help control costs by having some competition for insurance companies, making them be more honest with the costs and level the playing field so that we can get some better buys, more competition. Right now we have control by only one or two players in every state. So public option will inject some much-needed competition. A public option, besides driving down costs, will increase choices. And one of the things that we want to do with this plan is give more people a choice. But finally, a public option, excuse me, a public option will help insure the uninsured, to provide a basic level of health insurance so that we could end this issue in America of having so many people without health insurance, and in Ohio 15, having 92,000 of us without health insurance. Public option will be there for them, and there'll be a variety of different ways to assist people in paying for it if they're in the category of needing that kind of help, and to help employers pay for it as well.
Well, I really appreciate that because I went through that. I retired just a year or two prior to being able to get Medicare. And my wife is a diabetic, and I have high blood pressure. Most of the companies would insure me at a higher rate. They wouldn't touch her because she's a diabetic. And, I felt like this was very unfair. This was something that really, truly needed to be addressed. And contrary to what I heard a senator say today, that we have this excellent system, all it needs is this, this, and this. And I'm pretty sure as you talk with your constituency, you'll have horror stories that are probably even worse than mine. I also know people that have been canceled whenever they develop a chronic disease. They've also been canceled because of supposedly some pre-existing condition. One person had mumps, and that was a pre-existing condition, so they canceled her. So
you've hit on
really,
a real
really,
problem with our current healthcare system,
oh,
and a problem that I'm fighting to make sure we address in this bill. And two things that you mentioned there. One, pre-existing conditions. Because of amendments that I worked for and talked to our leadership and pushed to have included in the bill, the discrimination against people with pre-existing condition will no longer be legal 6 months after this bill comes into effect. And the original bill had that not coming into effect until 2013. So I'm really glad that we're able to change that, to move that up and address that problem immediately. The same thing with what we call rescissions, which is this other problem of, you get a disease that's going to require you to use your insurance regularly, and all of a sudden the insurance company tries to find ways to drop you. Rescission is the technical term for that, and that also will be prohibited in this bill. And I think that will be a big help for a lot of people.
Great.
Pick up any more. Hello?
Thank you.
Thank you, Norman, very much.
Thank you.
We're gonna.
Appreciate that.
Thank you, Norman. And Congresswoman, we're going to move on. We have Elizabeth. Elizabeth wants to ask you a question that I think a lot of people have, and it's how are we going to pay for it? But I will put Elizabeth on the call right now. Elizabeth, are you there?
Yes.
Hey, Elizabeth, you're on with Congresswoman Kilroy.
Thank you. Congresswoman, I just want to thank you so much for your work. And also the pre-existing condition and the rescission, all that, that's keep fighting, even if you need to stay in Washington longer, but keep fighting.
You.
I keep talking to my Republican friends, and they always say, but how are we going to pay for this? We're going to increase the debt. This just is not the solution that we can pay for right now. What do I say?
Well, first of all, we are paying a lot for health care right now. We spend more than $2.7 trillion on health care in this country every year. And that's not sustainable. It's not something that either the public or the private sectors can continue to see happen, unsustainable growth, and still have this issue of so many of us who are left out of the system. So we think there's enough money, and maybe too much money in the system. We need to find a better way to use this money. In doing so, making major commitments to preventive services and wellness. So some of the other ways that we're paying for it, we estimate that there'll be $110 billion in cost savings from negotiating with the drug companies. A novel idea, one that has been much criticized, was Medicare Part D forbidding us to negotiate with the drug companies. Well, it's time that we got a better deal from the pharmaceutical industry. We're talking about $150 billion in savings in Medicare and Medicaid overpayments to insurance companies. And we're talking about addressing the growth curve in federal spending on Medicare and Medicaid, taking politics out of it, and setting up a commission that will be able to make recommendations on how to shift payments to preventive services, to primary care and wellness, and to address the payment question so that we get more savings out of the system. Now, you may have heard that, when we say how much a bill is going to cost or how much a bill is going to save, that's through a scoring system used by the Congressional Budget Office. And they're pretty strict accountants. They go by dollars and cents. Now, many of us believe that they are leaving out some things. They're leaving out some of the cost savings that we think are there from the president's negotiations with the insurance companies, the hospitals, and the pharmaceutical companies, understating it by about a third, about $500 billion. Whoa. So that needs to be counted into the bill. But also with an emphasis on wellness and on prevention, on being able to live and manage a chronic disease like diabetes, like the previous caller's wife has, we can help people avoid some very costly complications, to live healthier lives, and to bring costs down in the system, either by keeping people healthy longer or helping people who have these diseases manage them and live well. We believe that over the next 10 years that we will see significant savings as wellness and prevention come into play. So, saving a baby from being born prematurely, that saves a lot of money. But that's something that the Congressional Budget Office isn't going to score. But if we could help a pregnant woman stop smoking and help her carry her baby to term through wellness programs and appropriate prenatal care, we'll save money for the taxpayers. So there's a lot that we will do. But finally, if we're not able to exact enough savings from the bill, one of the things that we're talking about is a surcharge that would affect fewer than 1% of the people in the 15th District. It's called a millionaire's tax, And we're watching it closely because, we're making a commitment not to tax middle-class families in our district.
Well, thank you so much, Elizabeth. I hope that answered your question. Just for those of you thinking about the poll results, almost 40% of you said that access for the uninsured was your primary concern. 24% the cost of healthcare premiums, 21% the quality of care you all are receiving, and 15% for greater choices for insurance coverages. So that's interesting, and we'll certainly keep looking at those numbers. We're going to go now to Terry, who has a question about a friend who has a pre-existing condition, it was diagnosed with cancer, and wants to know what this plan could do for her friend. So I think, Terry, are you with us?
Yes, I am.
Hey, Terry, would you like to ask your question to the Congresswoman?
Yes. Just like the gentleman just said, a friend of mine is dying with lymphatic cancer. It's all through her body. And she has no coverage, and she was taking chemotherapy, but it's not helping her, and she can't afford it anymore. So, plus she's got 4 children, and they have medical conditions also. There's one that's ADH, and 3 other ones that hear voices in their head, and she has to pay out of pocket for their medications, and it's really expensive. So I was wondering what the bill would do to help her and people in her category to get help or, medical support.
Well, the bill would allow somebody with pre-existing conditions to have access to health care benefits, and would allow them to pick from 4 different levels of benefit packages that they could choose to meet their health care needs. And a basic plan would include a core set of covered benefits. And I am reasonably confident that that basic plan would cover the kind of services that I think your friend needs. And I feel for her and for her children. That's a difficult diagnosis, and the treatments are very expensive. And we heard today from some women who were in a similar boat with your friend, who had health insurance but had very high deductibles. And their plan, which they thought was going to be helpful to them if they ever had anything devastating happen, they had a catastrophic accident or catastrophic disease, provided a $10,000 copay and then 30% of the cost of care. They never realized what the cost of cancer care could be. With the chemotherapy, with the medications to keep your blood counts up, radiation, surgery, the testing to see if the cancer is spread or not. All of those are extraordinarily expensive, and yet some people are able to recover and get their cancer into remission by going through those treatments. I don't want your friend or her children to think they lost their mother because of lack of health care. That's something that should not be allowed in this country, as great as this, as wealthy as this. I think we have a moral imperative to make sure that people like your friend are covered by health insurance. So this is why we want to make sure that this health care bill passes this year, that it can be signed into law and go into effect as early as we can, so that all Americans can have access to the kind of care that some Americans now are able to afford.
Great. Thank you very much, Congresswoman, and Terry, thank you for your call. We're going to go next to Jameson Pack, who has a question a little bit more on the details of the small business tax credit. But before we do that, we're going to do one more poll with you all. The next poll that we want to ask you is, what do you think are the biggest drivers of costs in our healthcare system? The Congressman was just talking a little bit about that and about how we're going to pay for it. So if you would like to, if you think that the biggest driver of cost in our healthcare system is the insurance company's profits and their administrative costs, press 1. If you think that the high cost of emergency room care for those that don't have insurance, the uninsured, is the biggest driver, please press 2. If you think that there's not enough focus on wellness and preventative care, press 3. And if you think it's just too many unnecessary procedures are being done, you can press 4 right now on your phone. I just want to remind folks that you can still press star 3 right now to ask the Congresswoman a question. We're going to try to get through as many questions as possible. We have just about a half an hour left on this call. And we're going to try to get as many questions as possible, and thank you for being with us. And when you do press star 3, you're going to go over to our almost like a little waiting room, and you'll have one of our great staffers take your questions so that I can shoot it up on my screen and get it over to and put you live on the screen. Congresswoman, I think Jameson is on the phone ready to say hi.
Hi, thank you for your call.
Well, thank you for taking it. First, I want to say that my husband and I are partners in a small business, and when we went to get health insurance as young people in our late 20s, we faced the issue of not being able to access health care easily and affordably. And after we were able to jump that hurdle and find a plan, we now are in a point where we would like to hire additional people, but as you know, the wages are not the only cost. And you had said that 13,000 people in our district could possibly qualify for a tax credit. And I was wondering if you could tell us more about that.
Absolutely. And as a small business person, I'm sure you know that small businesses pay more for their health care premiums than large businesses. They don't have that large risk pool to have benefit of. And they have higher administrative costs for the same reason. 25% of the cost of premiums for small businesses go to administration compared to 10% for large firms. So the new health insurance exchange that we're going to be setting up if this bill passes would provide small businesses, first of all, with access to affordable large group rates and access to stable pricing from year to year, lowering that administrative cost, and then giving your employees a choice of plans on that health care exchange. And small businesses with 25 employees or less, it sounds like you would qualify for that, and average wages of under $40,000 a year would get a tax credit of up to half of the cost of providing health insurance. So if the health insurance plan for your employees costs, say, $10,000 for 4 employees, maybe, then you would get $5,000 of that back straight off of the taxes that you pay, dollar for dollar. And I think that this will help small businesses, no matter what their average pay is, by lowering costs for all of us, prohibiting insurance companies from excluding coverage on basis of pre-existing conditions, refusing to renew coverage. A small business, if one person gets sick and increases the cost of claims for that small business, very often the insurance company cancels it for the whole business the next year or unreasonably raises the premiums. So that would give you stability by prohibiting those kind of practices. And it would prohibit insurance companies from charging different premiums based on an occupation, a pre-existing condition, or your sex. So we are hopeful that small business will see a lot of benefit from this. And I can go back to visit the small businesses that told me that health insurance costs are hurting their bottom line, that they want to provide it for their employees, but right now can't. And I hope that we'll be able to celebrate victory for all of us, including those small businesses in our community.
I do
thanks
too.
for calling.
Thank you.
Great. Thank you very much, Jameson, for your call. And we're going to go out. Let's see. I'm just trying to find all my questions here. I'm trying to get a different question for you, Congresswoman, so you're not answering the same one. A lot of very similar questions. But Bob Letcher wants to know a little bit about the process, I think, of where the bill is going to go, and also about some of the misinformation out there and how folks that support the plan can can help you out. But I just wanted the questions on our poll. Almost 48%, almost half of the folks that took our poll said that insurance company profits and administrative costs are their number one concern about healthcare. It goes down a little bit more to 21% not focused enough on wellness and preventative care, 19% for the high cost of emergency care for the uninsured, and 12% for too many unnecessary procedures. So, Congressman, we're going to go out to Bob right now. Bob, are you there?
Hi, Bob.
Yes, I am. Hi. Hi, I'm asking a question. You know, when I was raised, my mother and father always told me to share and share alike. And you know something, I'm still trying to do that. And the people next door matter to me. I don't know how it's possible to have neighbors whose health I'm supposed to not care about because this is a great United States or some other sort of thing, or because that silly guy at the Republican National Committee calls it socialists. So I think I'm wondering if there isn't a more aggressive stance available towards them. Just say, go away, or we care about each other. I mean,
Well, Bob, those are the right kind of values that we can look out for our neighbors as just as we look out for ourselves. And we could build the kind of community that allows each one of us to work to our fullest potential and gives each one of us access to health care. And that's why earlier I called it a moral imperative that we address the issue of the uninsured in our community, and that we also address the issue of the high costs that even working families who are working hard, having insurance, playing by the rules, but get hit, through no fault of their own, mind you, with a devastating illness or a devastating accident, and find that they're losing their home, losing their health insurance coverage, and their health is at risk. So we can address this issue with this bill. And it's been, through hearings in 3 different committees here in Congress. It's been filed for a few weeks now. The bill is on my website if anybody wants to read it themselves. There are also summaries there, and you could pick which section interests you the most if you'd prefer. And the committees have been working hard on it. 2 of the committees have finished their work, and another committee is Energy and Commerce Committee is working on it this evening, and they're going to continue to work on it. We're going to keep working hard to make it the best bill that we can so that it lowers costs. So it's a bill that we can afford as a country, that it gives us insurance coverage for all Americans, that gives us a choice of plans and doctors, and helps us obtain that primary care and those preventive services that really will help pay off in the long run in good health and in lower costs. Now, taking care of things like immunizations and certain annual tests that are, according to different age groups, we should all be having. Things that will help detect disease earlier and address them when we have a better chance of curing them, and helping us live well with chronic diseases like diabetes, for example. So after the committees continue their work, eventually it will come to the House floor. I am hopeful that it will come to the House floor yet this month. The Senate has 2 different bills that they're working on in their different committees of jurisdiction. So the Senate's got to work to put those 2 bills into one, and then it will go to a conference committee. And the committees and the party chairs will work in conference to try to reconcile what the House is looking at with what the Senate is looking at. So we'll take a look at how the House plans to pay for it. We'll take a look at how what the Senate's ideas are for paying for it, for example, and the conference committee will make some recommendations, and then it will go back again to both houses to vote on again. So this is a critical time for the bill, critical time if you believe that we can have quality, affordable health care for all, that we can increase the outcomes, have better outcomes for health care, that we can have an American solution to this problem. This is a great time to write letters to the editor or to send an email to Congress or to the Senate, call a talk radio show. But, I think that this is a historic opportunity to address something that I think we've needed to address for a very, very long time.
Great. Thank you, Congressman, and thank you for your call. Congressman, we have a couple questions on how this will affect Medicare and Medicaid. So I'm going to try to pick one because we have about 15 minutes left on our call, and so I am going to see if I can get Christine Swanson on the phone. Christine, I think you and your husband are listening to the call and want to ask the Congresswoman a question.
Yes, thank you. Thank you very much, Congresswoman. You're doing a great job.
Thank you.
My question is twofold, I guess. My husband and I are both on Medicare. We're retired. We're pretty healthy people. And this year, for the first time, we went on an Advantage plan with Anthem Blue Cross Blue Shield called Blue Medicare Access. And it's a very low premium that we pay every month with a ceiling of, I think, $4,500 per person per year. It's a pretty good plan. We've only had a little bit of experience, so we don't know what's going to happen next year. And that's always, kind of scary. What's going to happen year to year? But what will this bill, how will the bill change those of us on Medicare?
Well, I think for those on Medicare, most people on Medicare will see an improvement. Senior citizens and people with disabilities will certainly benefit from the provisions that will fill up the donut hole. The $500 subsidy to help close that donut hole in the first year, to decrease that donut hole in the first year, and then the elimination of it over time in the Medicare prescription drug program. Also for preventive services, it will eliminate co-pays or premium costs for preventive services. For those who are low income and in Medicare, it will improve the low-income subsidy programs for Medicare. It will help address some issues with physician payments, so we hope that more physicians will be participating in the Medicare program. And it will address future financial challenges with Medicare, improving payment accuracy, including some delivery system reforms, and extending the solvency of the Medicare Trust Fund, which is very important to the ongoing success of Medicare. One of the most successful programs I think we have in this country, but we want to make sure that it is there for a long time. Now, some of the Medicare Advantage programs will see changes over time. We're trying to find ways to pay for this, and Medicare Advantage gets subsidies from the federal government to private insurance companies to administer those programs, and people like you also pay premiums. So it is usually a costlier plan for services that are essentially the same as Medicare. Now, we're also, though, looking at some Medicare Advantage plans that have obtained high-quality results and cost savings by being able to manage costs through an HMO kind of option and provide some preventive services. So I'm not sure exactly how it will affect your plan. I think the better Medicare Advantage plans we will either maintain or we'll work them into the Medicare system somehow or other and take some of those ideas about managing health and wellness and apply them more broadly through the public option, and eliminate those that aren't doing a good job.
Yeah. Well, I think if everybody in the country could have reaped the advantages that seniors have with Medicare, it would be such an incredible improvement over what we have or have not now.
Absolutely. and the public option that will be available to uninsured people in this country, and the mandates for employers, the mandates for individuals, the assistance to low-income individuals to help pay for it, and the credits for small business to help pay for it, I think will move us in that direction in a huge way. The Congressional Budget Office thinks that 97% of the people in the country who don't have insurance will be able to get insurance through this bill.
That would be wonderful.
Thank you so much, Christine. And we're going to try to get through a couple more calls here. Congresswoman Rita is going to be on the line within a second. She's a little confused, and she understands health insurance companies will still be involved with the public auction. I think she's probably talking about the exchange that the bill will create. So, Rita, are you on with the Congresswoman?
Yes.
Hey, Rita, you can ask your question.
Yes. Thank you, Mary Jo, for taking our calls. My concern is that health insurance companies were set up for profit, and as long as we have for-profit agencies running our health, how is that going to be a cost-saving measure? Because as you mentioned before, I think you said the administrative cost for small businesses was 25% could be, and for large businesses it was 10%. As long as we have that administrative large fee in there with the health insurance companies, we're still going to be forking out a lot of wasteful spending. As the previous caller mentioned, it would be helpful if we would have a system somewhat like Medicare for everyone in America. It's an efficiently run system, not perfect, but as long as the healthcare insurance industry is in there, I see us as running more and more in debt, the taxes going up more and more, because it is a for-profit agency. I can remember my aunt when she first signed up for Blue Cross. It was a program that supplemented Medicare. And then insurance companies began to come into existence because they realized it could be a money-making deal, and so we had more and more insurance companies coming along. How can we change that from a for-profit agency to have our health run by a non-profit agency is, I guess, my bottom line question. Well, the health insurance exchange that's going to be set up will include a public option that is going to be run by a non-profit agency that will be able to provide different levels of insurance and allow people to comparison shop and pick the kind of insurance they want. It will give individuals and small employers the advantage of not just a large group, but a huge group to help lower the costs of insurance through the public option, or because a qualified private plan will be allowed to post their plan on the health exchange to take a look what the private sector has to offer too, and to be able to do that comparison shop and to see which health care they believe is what they need, what is more affordable for them. And for people with incomes, currently we're talking about up to 400% of federal poverty will be able to get assistance to be able to pay for that insurance in the public option on the health exchange. Or if they want, they would be able to take it to the private insurance industry as well. We have a system in this country that we're building on as we move to increase access to health care, and a system that's based for the most part on employer-provided private health insurance. And that's going to be continuing, but the health exchange with the public option and a robust public option that will provide different levels of different kinds of insurance plans, sort of be like buying a plane ticket on Travelocity, able to comparison shop about what you want to get, what you want to make sure is covered. And you may be right that that there are other ways that might do it better, but we want to make sure that we can get a bill done, and a bill that will pass Congress and that will have support. And right now, this bill has an amazing level, I think, of support from different organizations, from AARP to the AMA, the Nurses Association, and other national groups. And it is because we can obtain that kind of political consensus and support from various organizations, Families USA, Healthcare for America Now, National Association of Community Health Centers, the American Public Health Association. That kind of support makes this plan, I think, able to make it to this day, to where we were very close to a vote in the House of Representatives on a historic bill to increase access to health care for all Americans. Thanks, Rita. It's good talking to you.
Thank you. Thank you, Rita. Congresswoman, we're going to, in a minute, go out to Kevin, who had an injury, actually, so he's dealing with the healthcare system firsthand. He thinks the call is a great idea, but he wanted to tell you this yourself. But he also wants to know a little bit about how billing and paperwork and all that fun stuff, if anything like that would be affected. We have about 5 minutes left on the call. Two things. We have one more poll to go. The poll is, how much involvement do you think healthcare government should have in healthcare? If you think government needs to play a role in healthcare by creating a plan, a quality public option, a plan independent of the insurance industries that would inject competition, press 1. If you think government should have no involvement in healthcare at all, press 2. If you think plans like Medicare and Medicaid are good, but more than that, we need more help than that, press 3. And if you think government should make access for every American the priority and get it done, press 4. Also, folks, if you're still on the call, we still have a ton of folks on the call. I'm not going to be able to get to probably all of your questions. Maybe one more. You can stay on the phone at the end of this, and we'll be able to get a voicemail from you and be able to get back to you with your question, concern, comment. And so just stay on the end of the line, and it'll shoot you right to a voicemail, and you'll be able to talk with our leave us a message, and we'll be able to get back to you. Kevin, you're on the phone with the Congresswoman.
Hi.
Hi, Kevin.
Hi, how are you?
I'm great, thanks. How are you?
I'm fine. Well, I'm not fine. I've had an injury lately, but been off work for 3 weeks, and just got a bill from the emergency room, and I haven't been to the emergency room in a long time, and it just floored me when I got it, how much it was for the time I was there and for what they did for me. And so I guess my question was fairness in billing, or any regulations in billing, just to keep costs under control and things like that.
So there's a lot of things that we're working on to keep costs under control and to make sure that emergency rooms are used by people like yourself who have an injury, something urgent, or an emerging critical health illness condition, and to keep the emergency rooms from being a very high cost method of providing primary health care. So,
well, as an example, I don't know if I should put this out there, but I was there for 2 hours, received a few Vicodin pills for the pain, saw a doctor for maybe 10 minutes tops, that just looked at my arm and so on. And the bill is $1,080. And with my insurance, it's not my company's fault, but last year they had to change our insurance to a high deductible, which they never had to do before. So it's everything I get now up until $3,000 is out of pocket.
You're going to be paying for, yeah.
Yeah, I'm going to have to pay for all this.
Well, one of the things that we want to do is to set up this commission, a commission that would look at those kind of issues about hospital charges, and to make sure that people are not being overcharged, to provide reasonable reimbursement rates that are fair, but also that try to rein in some of the kind of costs that you're outlining there.
That would be great.
Yeah, but also in terms of overall for the system, to encourage more primary care, to help end the overutilization of emergency rooms, so that we can contain costs there as well. We want to eliminate waste and fraud and abuse and get healthcare costs under control. So it's important to know.
Are there any regulations in place now that kind of control that, what they can bill? A fair amount not above and beyond, something crazy or...
Right. Well, there are things called DRGs, diagnostic reimbursement groups. I can't remember what the exact acronym stands for. That for some federal programs to set a limit on what they will pay for certain procedures, and there's different ways that we try to avoid kind of the traditional fee-for-service in some of the federal programs. But we're also going to require providers to adopt compliance programs as a condition for participating in Medicare and Medicaid and the public option, to require people to have doctors and hospitals to adopt some best practices for healthcare outcomes, to try to direct us to paying for good outcomes rather than just paying a fee for service. We want to reduce the incidence of hospital infections, which is a costly problem for America and for American hospitals. And again, really take a hard look with an expert, empowered committee, a hard look at what fees are being charged, what the regional differences are. There was an article that President Obama has talked about in the New Yorker magazine that compared a hospital that had lower charges and better outcomes than a hospital that charged lots of money for its fees. So it's not just the amount of money that's being charged that's going to say whether or not you're getting quality care. There are a lot of factors that go into that.
A little naive because it's been a long time since I was in the emergency room, but I was really floored when I received the bill for what they did for me.
And I hope that you'll probably receive a few more after you get the initial emergency room bill too.
I know I will. I mean, I'm going to call and question it because to me it's just ridiculous. I mean, I believe in paying a fair price for what you need. I know they have to make money, but for a 2-hour visit, $1,000 is just ridiculous for receiving a few Vicodin pills.
Mm-hmm. Well, I hope you recover well from your accident.
Well, I'm on the mend, I think, and that's all good. But like I said, with my insurance and our deductible the way it is, and just the way everything is, it's not just the pharmaceutical companies, the hospital, it's everything.
The whole system. The system needs reform. There is no doubt about it. And how we pay for it, how we provide insurance, how the charges are made, the regional differences, the rural versus urban differences, all those kind of things need to be studied and take a look at and make sure that we're not paying for excessively for unnecessary procedures, but also make sure that our doctors and our hospitals are paid fairly for the valuable services that they do provide us. So
absolutely.
We're going to get this under control.
Thank you very much for your call, Kevin. We're going to try to sneak one more call in. We just wanted to also, I know there are a lot of folks with questions about Medicare and Medicaid. Folks in our district office can be very helpful with that. Their number there is 614-294-2196, and that's our district office that can help you with any casework you might have with any federal issue, but specifically if you have a question with Medicare or Medicaid. And I think the last question is from Pat. And Pat, we're going to go out to you in a second. Congresswoman Pat wants to know kind of the timeline of the bill. When does it go in effect, and where we're going to lead from here, hopefully once we pass it. So, Pat, are you on the phone?
Yes, I'm here.
Hi, Pat.
Thank you. Hello there, Mary Jo, and thank you so much for doing this. And my question was, when the bill is passed, when will it go into effect?
Well, different parts of the bill will go into effect on different timelines. That's one of the things that I've been concerned about and working on to try to move up the implementation timeline on various aspects of it. But in the first year, 2010, presuming the bill is passed by both houses and signed into law this year, in 2010 we can expect to see an end to the the health insurance industry's too frequent practice of rescinding existing health insurance policies as a way of avoiding the costs of one of their insured's health care needs. It will end the practice of discriminating against people on the basis of pre-existing conditions and require them to be covered. It will begin to simplify the administration of health insurance, reducing paperwork, standardizing transactions, and reducing the administrative burdens and the costs of the healthcare system by the proliferation of different kind of forms and policies and procedures, and to move to like a single unified form for that. It would help a new temporary reinsurance program so that if somebody retires early, they can provide early retiree health benefits for those aged 55 to 64. At 65, you'll qualify for Medicare. But in those age groups, if you retire early, it would help you retain your health insurance benefits. It will, the first year would also start that payment reform process that we talked about with Kevin. But it also, for physicians, it will end that 20% pay cut for physician services. It will improve prevention and coverage in Medicare and Medicaid. It will put $500 towards that donut hole. It will give rural and other hospitals discounts on drugs. And then it will also work, the Health and Human Services Committee will work to set up that health care exchange. Now, at the high end, the health care exchange won't come into play till 2013. If they get their work done earlier, it can go online earlier, but it must be done by 2013. So a lot of things about affordability and public health will also be worked in during that period of time between 2010 and 2013.
Great. Thank you, Congresswoman, so much. We're done with this call. We've been on for about an hour, and Congresswoman, there are almost 2,500 people on the call with you at one time or another tonight, and we got to ask you a bunch of questions. So thank you all very much. Again, stay on the line. If I didn't get a chance to ask your question, you can leave a voicemail for the Congresswoman, and we'll make sure to get back out to the staffs. Again, the website, if you want to tell us these great stories that we heard tonight, is kilroy.house.gov. And Congresswoman, do you want to thank everyone and sign off?
Well, I do want to thank everyone, and I want to assure you that I am going to be I have been working hard on this issue ever since I got here, and we're going to continue to work hard on it until we get the best bill that we can get passed in this Congress to make sure that the 90,000 plus people in Ohio 15 who don't have coverage can see the hope that affordable insurance coverage will be available to them, that we can improve the quality of health care and start really moving towards prevention and wellness and medical homes and primary care, lower the costs and give people choices. I thank you for taking your time tonight to ask your questions and to listen to this call. It's much appreciated, and I look forward to seeing you back in the district. And I'll be back a lot in the month of August, and I come back every weekend and try to meet with people in Ohio 15. It's my great honor to be able to serve you here in Congress. So thank you.